Hi, I'm Dr. Blick. What can you expect after a thread lift procedure? So, of course, we're using needles. So, with needles, there might be bruising, there might be a little bit of swelling. But after the procedure, when you walk out of here, you'll have skin color plasters on the little entry sites, and then there might be puckering as well. So, what is puckering? Puckering is a pleat. When I'm lifting the skin, I give it a good lift. So, there might be, if you've got additional skin, there might be that little bit of extra skin fold on the side of the face or a little bit of irregularity on the skin surface, but that all heals. Give it 2 to 4 weeks and that's completely settled, so you can already go back to work even on the day of the procedure, or give it a day or two afterwards. And you can cover everything with makeup, you can let your hair down and let everything just heal on its own. So how do threads procedures work? So there's different types of threads in the market, and each one has got its unique characteristic. They last different durations. One might give a more subtle lift, one might give a more accentuated lift. But how I do it is usually depending on which area that I'm treating. So always I anesthetize the area with a bit of lignocaine, and then I make a little needle prick, so there's no cutting, there's no knives, there's no blades involved. And then I insert the thread, and the thread is on a cannula, which is a blunt needle which contains a thread. I insert that needle, then I pull it out, and as I pull it out, this thread comes out and hooks underneath the skip. So the thread has got these little barbs on it. They call it multicentric barbs. In other words, it goes in different directions, and that hooks the sagging tissue and gives you that gentle and subtle lift. So one of the concerns which patients come to me about when having threads is they've heard stories from their friends or other patients that have had threads, and they say, are the threads going to be visible, or the threads are going to cause surface damage to my skin. So it's all about using the correct thread in the right area, and then also to ensure that you're the right patient for the threads, and then get the right practitioner to insert the threads. So important with threads is to insert it on the correct plane. That's the subdermal area underneath the skin. And if you insert it too superficially, yes, then you can see the threads. Then you can, and that can take a long time to heal. If you insert the threads too deep, then you can hit structures like a nerve, a blood vessel, which just can cause a bleeding or a bit of numbness. But it's about, like I mentioned, inserting it on the correct plane. So what can I expect after the thread lift? So important, it's not a facelift. Expectations are very important. If you're expecting a facelift, then go for a facelift. Rather, if you're expecting just a more subtle, natural lift with a bit of contouring and a bit of skin rejuvenation, then threads might be the right option for you.